Okay, Carrie, let me know when you're switched and then I can get started.
I'm ready.
Okay, good.
Thank you.
Uh, Good evening, everyone. I have the absolute pleasure of having with me Mayela Correa, a nurse from Mexican descent, I should say. I should call her a Mexican nurse, actually, it should be more appropriate. Um, with lots of experience working with one of the best institutions that they are to actually do her work. We're going to talk with her a little bit today about her experience as a nurse, and I'm going to ask her a few questions. Hopefully, Mayela will give us a good insight of how it is to work as a nurse in the United States. And the intention is to give you guys really a good understanding of when you want to come and live and work as a professional nurse here, what does it entail really to do that? Buenas noches a todos. Tengo el absoluto placer de tener con nosotros a Mayela Correa. Mayela es una enfermera de descendencia mexicana, trabajando en una de las mejores instituciones hospitalarias que hay en los Estados Unidos. Lo que vamos a hacer esta noche es vamos a charlar con Mayela para que nos dé un poquito su experiencia como enfermera trabajando en los Estados Unidos, sobre todo charlando un poquito como una enfermera de descendencia hispánica, como es el trabajo de ella aquí en los Estados Unidos. Lo bueno es que Mayela habla español, so no necesito traducirla, ella se va a traducir solita. No, no, if you need to, I'll be happy to help. Mayela se va a traducir solita y van a poder charlar con ustedes directamente. So, uh, Mayela, let me start with just a couple of background questions, just so people know you a little bit better. Obviously, I'm going to ask you, how long have you been a nurse, and tell us a tiny bit about your professional career. Okay, we'll go a little bit deeper on a few of the items, but just tell a little bit the people about that. Le estoy pidiendo a Mayela que empiece por contarnos un poquito, obviamente, de su carrera, de su historia profesional y vamos a, obviamente, a profundizar un poquito en eso y después nos va a dar una oportunidad de oír un poquito más cómo es su trabajo. So, Mayela, what made you become a nurse? How long have you been a nurse? ¿Qué te hizo que te convirtieras en una enfermera y cuánto tiempo llevas de enfermera?
Honestamente, cuando empecé mi carrera, yo pensé que iba a ser doctora, pero seguía una enfermera practicante y me encantó el trabajo que ella hizo. Y yo supe que eso era parte de lo que yo quería hacer para mi carrera, especialmente que la comunicación que tengo con mis pacientes es diferente a la comunicación que tiene con el doctor. Y me encantó ese aspecto de ser enfermera. Entonces decidí de cambiar mi carrera cuando estaba en la universidad.
Okay.
Lo
I'm
bueno
gonna,
es que,
I'm gonna ask you to take a little pause and translate that into
yeah,
English.
sorry. Um, I thought that I would be a doctor when I first started my career. Um, but I followed a nurse practitioner when I was about a year or two into my university, and I loved the work that she did. And when I talk with her about how she started her career and as a nurse, I knew that that's what I wanted to do. The communication that you have with patients is so much different than the communication that a patient has with a doctor. And that's the connection that I wanted to have with my patients.
Really good. Mayela, explain to people a tiny bit what is a nurse practitioner. Many do know what it is, but some people do not know what it is. Explícales un poquito a las personas que es una enfermera practicante, porque no todo el mundo sabe qué exactamente es una enfermera practicante.
Yeah, so a nurse practitioner doesn't have to work technically under a doctor, but the way that we do it on our team, they do. She or he can see patients separately as a doctor, appointments, visits. They can set up procedures. testing, labs, medication changes, all of that can be done through a nurse practitioner. The only real difference is schooling. Obviously, if you want to advance into like surgery or anything like that, you can't do that as a nurse practitioner. But schooling is definitely very different, especially since you have to start off as a nurse. So the relationship that you have with patients is also a little bit different in how you communicate with them.
So now take a second and translate.
Um, Enfermera practicante es diferente de ser un doctor por la escuela que tienen que tomar. Primero tenemos que empezar como enfermeras, a veces 1 o 2 años antes de empezar la escuela, que puede ser otros 2 años de escuela. Um, pero ellas, las enfermeras practicantes pueden dar medicaciones, pueden ordenar exámenes o ordenar like procedures or
Procedimientos.
procedimientos, perdón.
Ujú.
Pero hacen mucho del mismo trabajo que hace el doctor, nada más que en mi opinión, la comunicación que ellos tienen otra vez con los pacientes es un poquito más diferente. Las enfermeras practicantes con las que yo trabajo toman más tiempo con el paciente que el doctor. Ellas toman 45 minutos a 1 hora, un doctor va a tomar 30 minutos porque tienen más pacientes para ver durante el día.
Okay, very good. So that motivated you to start your nursing career. So after you finish school, do you knew already what you wanted to do as a nurse, or you just said, well, I'm going to sort of explore some areas and see where I want to go? Cuando comenzaste tu carrera, ¿tú ya tenías una buena idea en el área que querías trabajar o que querías practicar como enfermera, o empezaste en un área y de ahí decidiste como explorar otras oportunidades?
Um, I I had began nursing school with the thought that I would go into pediatrics. But when I did my clinicals, I fell in love with cardiac. Um, so that's what I decided I wanted to do once I graduated. I found a cardiac step down unit,
Ujú,
and I started learning a lot. So, and I loved all of it. And I wanted to continue learning into it. So that's why I moved into outpatient heart failure
ujú,
to kind of delve into more of a specialty.
ujú.
Um, and I love it. And I've been learning so much about it. And I'm only going to keep growing. So,
Okay. So I need you to translate for a second.
yeah. Yo empecé la escuela de enfermería pensando que iba a estar trabajando con adolescentes, pero cuando hice mis clínicas, yo supe que yo quería hacer algo con del corazón. Um, Empecé en un piso de paso cardíaco, donde trabajé con pacientes de insuficiencia cardíaca, y yo supe que yo quería crecer mi carrera en eso, entonces me moví a un hospital diferente, Northwestern, para aprender más de eso
Okay,
y sacar una especialidad de eso.
okay. En Sudamérica, step down units in general just consider intermediate care units,
Ok,
unidades intermediarias.
yeah, good
Okay.
one.
Okay, there are not so many. They tend to just have critical care and then just the general floors.
Oh, okay.
The two levels of care, which has been a long debate here in the United States.
Yeah.
Okay. Um, so de entrada, after leaving school, so you started right away working already on cardiac care.
Yeah, I
Okay.
did.
So, what was your experience now working in that world, right out of school? You enjoyed that very much?
Um, tuve que, I had to obtain certifications for the floor,
Mhm.
because they required a little bit more care.
Mhm.
Um, so I did have to do that. It was a big learning curve because a lot of what they taught us in nursing school wasn't enough for the plethora of cardiac issues that can arise.
Mhm.
So I did have to do a lot of learning, but the floor that I was on offered a lot of opportunities and people that, were really open to all my questions, and they offered literature for me to even keep learning to be able to succeed on the floor.
Okay, that's a question I'm going to ask you, but translate that piece first.
Cuando yo empecé en el piso, tuve que obtener certificaciones para poder trabajar allí y aprender más, porque hay muchos problemas cardíacos que no nos enseñaron en la escuela de enfermería, que tuve que aprender allí. Pero lo bueno es que el equipo con que yo trabajé era excelente. Ellos siempre estaban abiertos por una pregunta, y siempre me daban literatura para poder aprender más también.
So the key question there, Mayela, is because we always mention to people that hospitals always encourage people to learn, and they
Ujú.
even provide with a yearly stipend for people to actually go and study. Do you want to say a little bit about that? Aprovechando que Mayela menciona eso, recordarles a las personas que los hospitales les interesa que ustedes avancen clínica y profesionalmente y también les dan un subsidio anual para educación. Entonces, Mayela, cuéntanos un poquito sobre eso.
Yeah, I actually speaking about that, Northwestern has affiliates with certain schools so that you can continue learning, like becoming a nurse practitioner. So some schools will offer you discounts as well. So like Lewis University, we would get 40% discount as Northwestern employees. And then on top of that, Northwestern also gives you an extra 10,000 a semester to cover for it. So if you're doing it correctly, you might not even have to pay for extra schooling, um,
So
depending on how many
yeah, tell,
classes you want
tell,
to take.
tell people that because they would love to hear that.
Yeah. Yeah, that's
In,
one
Sp
of the main reasons why I love Northwestern. So,
in Spanish.
yeah, so hablando de eso, también voy a empezar para la escuela para ser enfermera practicante, y Northwestern ofrece descuentos en otras universidades, como Lewis University te dan el 40% o te
Mm,
quitan el 40%, y luego el trabajo, Northwestern nos da 10,000 cada semestre para poder cubrir los costos, y así no tienen que pagar cada semestre.
okay. Eh, Northwestern es el sistema, el hospital en el que Mayela trabaja. Y eh, lo que ella está explicando es que muchas de las instituciones tienen afiliaciones o tienen relaciones con ciertas universidades o ciertas instituciones que ofrecen estos cursos avanzados. En este caso en particular, este hospital, por su afiliación con una de las universidades, descuentan, como Mayela explicaba, el 40% de la matrícula y el hospital de por sí les da un subsidio anual, un subsidio semestral en este caso, de casi $10,000 para pagar el resto de la matrícula. Así que para efectos prácticos terminas haciendo eh, los estudios casi que gratis. Okay, so that is an awesome benefit. Are you about to start your nurse practitioner?
Yeah, I'm applying actually as we speak.
Okay.
I'm applying today.
I will make sure that Lisa gives you a very good reference. Yeah, very nice, very nice.
Mhm.
So you said to me earlier that you started working actually on a different institution, right? You started to work for a different hospital. How long were you on that hospital?
I was at,
Sorry, let me translate this
oh
question.
no, you're okay.
Mayela comenzó a trabajar en realidad inicialmente para una institución diferente a la que se encuentra trabajando en este momento. Le estoy preguntando que cuánto tiempo trabajó allá y, en esa institución.
So I worked at my first job for about 9 months on that step down unit.
Mhm,
Um, and then I switched over to outpatient. So I went from inpatient to outpatient because it gave me the ability to learn more about the specialty in cardiac.
mhm.
Um, so yeah, about 9 months. Yo tomé 9 meses en mi primer trabajo en el, I'm sorry, how did you say, I guess it's not a step down unit, but
Una unidad intermedia, de cuidados intermedios.
de cuidados intermedios, perdón. Sí, trabajé allí por 9 meses, obteniendo mis certificaciones, aprendiendo un poquito más, y luego me decidí ir a la clínica, en vez de trabajar en el hospital para poder aprender más y seguir mi educación.
Mm. So that's a question we get with some frequency, Mayela, because obviously a lot of people want to know the possibility of moving from one service to another. How hard was it for you to go from one service to another? Was a little bit of luck that you were able to do that? Is this something that people do routinely? Una de las preguntas que nos hacen con frecuencia es qué tan complicado, qué tan difícil es si uno arranca en un servicio, moverse a otro servicio, si uno lo que le interesa. Cuéntanos un poquito cómo lograste eso y si eso es una cuestión de que tuviste suerte, que pudiste hacerlo o es una cosa que normalmente lo hace todas las personas.
Es, sorry. It was easy for me, but again, I had a great team to work with. They made the transition super easy, Lisa being part of that team. I work in a team where we all sit in one room, and if you have a question, you say it out loud and someone has an answer for you.
Mm,
So, and the nurse, my coworker that I work with, Adele, is amazing. We sit side by side. She walked me through every step,
mm,
answered every question. So they made it incredibly easy to be able to fit into a whole different group. I did get lucky getting the outpatient job because a lot of outpatient clinics require a certain amount of experience, which is usually at least more than 3 years, and I only had 1.5. So I am very grateful for the opportunity that they gave me there.
Okay, so translate that.
Yo, cuando yo empecé en el equipo de la clínica, fue muy fácil porque el equipo siempre ofrecía ayuda. Todos trabajamos en un cuarto y si alguien pregunta algo, alguien tiene una respuesta. Y si no la tienen ahí, lo van a buscar. Siempre hay ayuda, siempre pueden preguntar lo que están pensando o si necesitan ayuda con medicaciones o algo así, siempre hay ayuda. Hasta los doctores siempre responden. Am, por eso yo creo que fui muy, how do you say lucky? I'm sorry.
Tuve mucha suerte.
Tuve mucha suerte en eso.
Ujú,
Tuve mucha suerte en eso porque a veces las clínicas quieren que las enfermeras tengan 3 o 4 años de experiencia antes de empezar allí, pero yo nada más tuve 1 año y medio y ellos me dieron esa oportunidad y he aprendido mucho. Estoy muy agradecida por esa oportunidad.
So, específicamente, specifically, tell us a tiny bit of what are you currently doing? What are you currently working on?
Sí, yo trabajo I work with the heart failure team
Mhm,
right now, which consists of 2 nurses, including me, 2 doctors that specialize in heart failure, and 2 nurse practitioners. So my day-to-day kind of looks like I go to my work, sign in, I do my refills for the day for the patients that need it, make sure that they all have their refills. I go through results, set up, help, talk to patients whether or not they need procedures done, new medications or testing that needs to be done. Make sure that they're educated in that before they make their decision. Um, I answer my chart questions or phone calls where patients call in with concerns of blood pressure or if they have certain symptoms like shortness of breath, weight gain, anything like that's related to heart failure symptoms, we will get those and we will respond accordingly. Um, but we are kind of like the bridge of communication between the patient and the doctor and the nurse practitioner, but we all work as a team. We also started something called the infusion unit.
Okay, before you go there, maybe let's translate the first part.
Yeah. Yo trabajo con un equipo de otra enfermera, dos enfermeras practicantes y dos doctores en insuficiencia cardíaca. Nosotros vemos muchos mensajes de pacientes. Cuando empiezo mi día, empiezo con medicaciones, asegurándome que todos tienen lo que ellos necesitan. También em, voy por los resultados de exámenes. Los doctores nos mandan mensajes con los cambios que necesitan los pacientes de medicación, otros exámenes que necesitan o se necesitan cirugía. Hablamos con los pacientes, los educamos antes de que ellos hagan esa decisión. También contestamos llamadas, mensajes que ellos nos dejan de preocupaciones de su presión, síntomas de insuficiencia cardíaca, como si no pueden respirar o siente que se sienten muy cansados, preguntas así. Pero nosotros somos como how do you say bridge in Spanish? Sorry.
Un puente.
Somos como un puente de comunicación
Mm,
del paciente y enfermera practicante y el doctor.
ok,
Pero como equipo, nosotros siempre estamos juntos cada miércoles y hablamos de todos los pacientes que tienen problemas o están en el hospital y qué podemos hacer diferente en la clínica y todo eso.
okay. So, you were going to say the second part, so
Mhm. We also have an infusion clinic that was started for heart failure patients specifically, because a lot of our patients have issues with fluid overload since their heart's not pumping it out the way that it should. So they get weight gain, shortness of breath, fatigue, all of that. So what we do is we triage that through phone calls and messages. We have the patients come in for what's called a nurse visit. We assess them, make sure that their labs are okay, make sure that their kidney functions aren't too high. And then we meet with either the nurse practitioner and the doctor, and we decide whether or not we infuse them with diuretics, which help with their symptoms, help them get rid of that fluid, to keep the patient out of the hospital, since a lot of heart failure patients tend to have reoccurring admissions, um, because of the severity of their condition.
the condition. Now, let's take a breather and let's say it in Spanish.
Tenemos una clínica de infusión para los pacientes de insuficiencia cardíaca. Ellos nos mandan mensajes de sus preocupaciones, como si subieron de peso por todo el fluido que tienen en su cuerpo, como su corazón no está sirviendo como debe, se acumula fluido, no pueden respirar, se sienten cansados, su presión está alta. Ellos nos mandan esos y nosotros vemos si ellos tienen que venir a la clínica para hacer una visita de enfermera. Y si ellos vienen, tienen que hacer exámenes a la sangre antes de venir para asegurarnos que sus riñones están bien antes de darle más medicación. Cuando ellos están ahí, lo accesamos y le damos la medicación que se llama diuretics, not quite sure how to,
Diuréticos.
diuréticos, para sacarles todo el fluido
Mhm.
y
And,
para
and,
que no tengan que
and,
regresar al
and,
hospital.
and assessment in Spanish, evaluación.
Evaluación, perdón.
Evaluación, no hay ningún problema. I think people, I'm glad because that way everybody gets to really pick up on a lot of those words. Remember, they are all preparing for NCLEX, so they do need all that language.
Pues ya,
Yeah.
evaluación, perdón.
No, no, muy bien, muy bien. Um,
Um,
so, Yeah, so you refer to it as a clinic, but I think maybe a better term for where you work is a diagnostic and treatment center, right? You have your team is also part of the larger team who is doing a lot of the procedural work too on some of those cardiac patients.
No.
Let me translate. Estoy tratando de que me expliques si trabajas en una clínica o trabajas en un centro de diagnóstico y tratamiento que incluye las áreas de procedimientos también.
So for our clinic, we have different teams that kind of do that. So for example, Lisa is IR. So if one of our patients needs a coronary angiogram or what's called a left heart cath, then we would refer them to that department and they would be the ones to set that up. Our heart failure doctors don't do any of those other types of procedures. So
Right.
we'll set up life vests and all of that for the patients, but we don't do that in the clinic except for like the infusions.
Okay, so you just focus on the infusions and that's the part of the work. Um, the within your team, no, people always wants to know a little bit of the level of assignments that you can anticipate you will have. Let's say maybe let's initially talk about when you were on the in the step down unit or in the intermediate care unit, what
Mhm.
kind of a work assignment that you actually had, and if you can contrast that a little bit with the type of work assignments that you have now in this clinic. So, una de las preguntas que la gente siempre quiere saber tiene que ver con las cargas laborales. ¿Qué tipo de asignaciones de pacientes tenías cuando estabas trabajando como enfermera en el área de hospitalización? Versus ahora que ya estás trabajando en una clínica, ¿qué tipo de cargas laborales manejas?
So when I started inpatient, I was on day shift. So day shift works a little bit differently patient-wise compared to night shift. So day shift tends to be a little bit more chaotic. So we would have about 4 to 5 patients. Um, and there was usually about 5 to 6 nurses on a 35 patient floor.
Okay.
Um, we would work 12-hour days. But obviously, you have to be there 30 minutes before work so you can get handoff, 30 minutes after work to give handoff. So it's a little bit longer than 12-hour days sometimes.
Mhm.
Um, and compared to inpatient, where I don't technically have to see patients every day unless I'm doing infusions, we go through 30 to 40 messages. And then that's not including the 10 to 20 phone calls we can get in a day.
Mhm.
And then whatever results, sometimes we could go through 20 to 30 results, and that's not including infusions if we do see patients, um, or um, staff messages where we have to follow up with other patients
Yep.
along with monitoring.
So let's translate that if you don't mind.
Yeah. Trabajando en el hospital, yo trabajaba durante el día, que es un poquito diferente de la noche. Hay un poquito más de desorden durante el día porque todos están despiertos, necesitan todos los exámenes, todo eso está pasando durante el día. Yo tenía de 4 a 5 pacientes dependiendo del día. Siempre había 5 a 6 enfermeras en el piso por 35 pacientes. Eso sí, todos los cuartos estaban llenos. Am, es un poquito diferente a lo que hago ahorita, pero en el hospital trabajas 12 horas, pero siempre tienes que venir 30 minutos antes, para hablar de los pacientes y 30 minutos después.
Mhm.
So, toma un poquito más, pero nada más trabajas 3 veces a la semana
Mhm.
en vez de los 4 o 5 días que yo trabajo ahorita.
Okay.
Ah,
Trabajabas 3 turnos de 12 horas,
sí,
comparado que ahora trabajas 5 turnos de 8 horas.
sí.
Okay.
Pero a veces si no había enfermeras para cubrir las noches, yo me quedaba en vez de 7 me quedaba hasta las 11 para cubrir hasta que la otra enfermera podía
Llega.
venir.
Mm. Y obviamente, tiempo extra como parte de esas. Hoy en día, no, en general, en las clínicas en general no tienes mucho de esas situaciones donde tienes que quedarte trabajando tiempo extra.
No, honestamente, mucho del trabajo que podemos hacer se acaba en las 8 horas.
Ujú.
Y si es algo de emergencia, se van a la emergencia. Eso, por eso me encanta la clínica, porque si no hay ayuda ahí, siempre hay ayuda en otro lugar.
En,
Um,
en los servicios
pero
de
en el hospital nosotros somos la ayuda y por eso
Ujú.
siempre alguien tiene que estar allí.
Okay.
Um,
No.
yeah.
Very good. So, a question I'm sure some people may be asking when you said that you work with some nurse practitioners because they want to know, and you want to become one. They want to know what type of nurse practitioner works on cardiac care because you hear the CRNAs or you hear some of the OB nurse practitioners, the midwives, etc. So what kind of person, what kind of no, nurse practitioner are cardiac services looking for? So, le estoy pidiendo a Mayela que ella que trabaja y está interesada en volverse una enfermera de práctica avanzada, ¿qué tipo de enfermeros practicantes trabajan en el área de cardiología? Porque uno normalmente oye sobre los enfermeros practicantes en anestesia, los enfermeros practicantes en obstetricia, en otras, pero en particular en cardiología, ¿qué tipo de enfermeros practicantes?
Yeah, there's a couple different degrees now, and it's a little bit of a gray area. Um, for our nurse practitioners, they got what's called their MSN and FNP, which is just the masters to
Ujú,
become a nurse practitioner.
ujú,
That's usually, depending on how you break up your classes, about 3 to 3.5 more years of
ujú,
schooling.
ujú,
And then there's also a DNP, so the doctorate, that's an extra year and a half. Um, it's a little bit murky because the MSN FNP, some of them allow you to do inpatient and outpatient, but they're trying to change it where it would only cover outpatient.
ujú.
And then you would need your DNP to do inpatient care as well.
Okay. So, I don't know if you can translate that. I'll give you a hand a little bit on that. Give it a shot.
Um, para ser enfermera practicante en la clínica, se hacen lo que se llama el MSN, o
La maestría en enfermería.
yeah.
Ujú,
Eso toma 3 o 3.5 años para completar. Um, y para hacer, para trabajar en el hospital como enfermera practicante se necesitan el doctorado,
ujú. El doctor.
para poder hacer eso. Y eso toma un año y medio más de escuela
Ujú.
después de la maestría.
Ok. Pero esta es una maestría en Family Nurse Practitioner, right? De
Ujú.
FMP. Esta es una maestría en un área específica de servicio. Buena pregunta, Family Nurse Practice. En servicios como medicina general, pero enfocada a la parte general de la familia. Y de ahí hacer el doctorado para la parte de enfermería. Very good. Um, Mayela, here is a tough question, but I would like you to, because this question comes quite often, but I need you to be as honest to these people. We get, not always, but every once in a while, a tough question when people ask, is there a lot of discrimination to foreigners, to people who is not, no, whatever the image is of the standard American? Is there, are foreign nurses or foreign people, in particular in healthcare, treated well? Are they discriminated a lot? So, con frecuencia recibimos una pregunta que a algunas personas les interesa saber, sí, qué tanta discriminación hay con respecto a personas extranjeras o personas que son diferentes, particularmente en el sistema de salud de los Estados Unidos. And be as bold as you can on this. So give us your perspective and your experience, if you don't mind. Danos no seas tema. Dinos exactamente, no, en tu opinión, qué es, cómo se ve el asunto.
Honestly, where I work in Illinois, there's a lot of diversity. Um, a lot of the people that I work with, it's a very diverse team, especially in the hospitals where you work in Chicago.
Mhm.
Um, so I will say, obviously, there can be mistreatment of nurses sometimes, but I think that's just as a whole, not
Not because of not because of you being of Latin
yeah,
descent, or it's
yeah.
just there is some war
It's just
related.
yeah. It's more of just if there's mistreatment, it's because you're a nurse, not because of who you are. Um, I personally have never experienced any of that. And if there ever was an issue of discrimination, it was dealt with accordingly, especially on my floor. We definitely had some patients, they will speak their mind. And as a nurse, you have to stand up for yourself, obviously in a polite and way, not yelling or anything like that. But there has been times where that has happened to a coworker and management steps in almost immediately. That's why finding a floor where management cares for you and you as a whole team, you work together. That's important to find because they're the ones that always have to have your back on stuff like that.
Yeah. Would you like to translate that for everyone?
Yes, please.
Oh, you want me to do it?
Oh no, sorry. I'm
No,
just
no, I
my
would like
cat's
you to
like
do it.
messing. No, 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 you're okay.
No, 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 no. Please, please, no, no. I'd rather you comes from you.
Yeah.
Okay.
Um, honestamente, yo no he visto nada así en donde yo trabajo. Yo trabajo en un estado muy diverso. Hay gentes de diferentes lugares. Um, yo, la problema no es de dónde vienes, es más de ser enfermera. Si hay maltratos de los pacientes son por I guess how do you say, for being a nurse is what your
Por ser
field is.
enfermera y no por ser latina o no por ser de extranjera. Es más por el hecho de que eres una enfermera y tienes que hacer ciertas cosas o esperan que tú tengas que hacer ciertas cosas.
Sí.
Ujú.
Por eso yo creo que es importante de encontrar un hospital donde hay un equipo bueno y los directores, si algo pasa, ellos van a tener sus espaldas con todo eso. Tienen que tener, um, I'm so sorry. They need to have like a good um, communication with them so that they can be able to talk to them about the issues that they might be having with patients.
Ujú.
Um, Tienen que tener buena comunicación con los directores para poder comunicar problemas que tienen con los pacientes y no tengan que quedarse con eso.
Have you, do you work with a lot of diverse nurses? Do you have a lot of people, other color, other backgrounds, other nationalities? ¿Trabajas con gente con diversidad, personas de otro color, personas de otros países, personas obviamente con extranjeros?
Yeah, when I worked inpatient, I worked with a big diverse group of people. I had people from the Philippines, from Poland, Romania, Mexico, Brazil, and a lot of them were also travel nurses. So we have a big diverse group with that we work in Chicago of nurses.
And
I feel like
current,
that's not something that we lack here in Illinois, which is nice.
traduce.
Trabajando en el hospital, siempre había un grupo diverso de gentes o de enfermeras, debo de decir, polacas, indias, um, filipinas y latinas. Sí, había muchas. Eso yo creo que por eso trabajando en Illinois es muy bonito, porque hay grupos diversos en todos lugares.
Mhm. That's actually an important point to for everybody to know. And even for um, trying to get a position, do you feel that there is any discrimination if you and somebody, a Native American or whatever, no, somebody may look, not you're Native, but somebody may look more Native American will be applying? Do you feel that they will have a leg up on you, or you're pretty much on equal footing with them? Sí, la otra extensión de eso es como una persona, obviamente, hay las oportunidades son iguales para todos o hay preferencias a algunas personas.
It's very equal opportunity. Um, when you start applying, there's obviously, a cohort that they will interview at a time. They go kind of by when nursing schools graduate. So there's cohorts and there's different people that apply for all these kinds of positions. They like I said, if my floor is full of diverse people, they're not really going to pick one group of person over another. I think one of the biggest issues is just finding nurses. So they're very open to any nurse,
Ok. Traduce eso.
regardless of nationality.
Ujú.
Um, yo creo que ahorita hay más problema que no hay enfermeras para estas posiciones.
Mm.
Um, ellos no van a discriminar a la enfermera por dónde vienen, porque hay posiciones que tienen que llenar. Y como dije antes, en el hospital donde yo trabajaba era un grupo diverso. A toda la gente que aplicaban, si tenían la experiencia, si sabían lo que ya estaban haciendo, iban a ser enfermeras en el hospital.
Ujú. That's really good. So, a couple of other key questions that always people want to know, and you don't have to be specifics on this, but could you tell us a little bit about compensation and benefits? Are nurses, you feel, well compensated for their work? Are nurses, receive good benefits for the work that they kind of do? Una pregunta que obviamente todo el mundo siempre quiere saber es si la compensación de una enfermera es buena, si los beneficios que los enfermeros reciben son buenos para poder mantener un buen nivel de vida. Give us your perspective on that.
Yeah, working in the hospital versus in the clinic, there is a little bit of a pay difference, but that's because of the type of patients that you get. So in the hospital, we worked hourly, and depending on the amount of experience that you had, you got paid a certain amount. But I'll be honest with you, most starting pays is going to be about $35 to $36 an hour in a hospital, which is going to be different in different states because in Illinois, they're going to pay you a little bit more versus if you went somewhere in like Arkansas or something like that. Um, so that's hourly, and then a lot of them offer really good insurance, vision, dental, um, medications, all of that. They offer really good benefits and they match 401ks as well. So if you want to save 6% of your check into a 401k, they will also match that. So you'll be getting about 12%. Um, and then outpatient, I'm a salary. So it's different because of the amount of patients that we see, inpatient versus outpatient. So they're gonna pay you a little bit less for outpatient versus inpatient. Um,
They just treat you as a professional salary and you just earn a salary and not an hourly base.
um, yeah, no, it's you, they give you a set amount. It's like a salary.
Yeah, that's what I said, that
Yeah. Oh, sorry.
yeah,
I didn't hear you.
you get paid a salary as opposed to you don't need to account for your hours.
Yeah.
You just get paid as a professional salary.
Yes. Professionals.
So,
Sorry.
you want to give it a shot to say it in Spanish?
Um, yes, I apologize for the broken Spanish. En el hospital nos pagan por la hora. Dependiendo de la experiencia, empiezan a $35 a la hora. Pero si trabajan en la noche es un poquito diferente. Le pagan creo que $3 o $5 más por trabajar en la noche. En la clínica es salario, sí pagan menos, porque no ven muchos pacientes al día como si fueran al hospital. Eso es un poquito diferente. I don't know if I
Te
missed it.
pagan, en las clínicas pagan a nivel, te pagan un salario y no por el trabajo por hora, ganas un salario que está negociado de antemano versus
Sí.
en los hospitales que negocias un salario por hora y te
Ujú,
pagan basado en el número de horas que tú trabajas para completar tus tiempos. Hay diferenciales nocturnos, obviamente, en los hospitales,
ujú,
que no hay en general en las clínicas, y diferenciales de fin de semana en los hospitales, que no hay tampoco en las clínicas. Por eso un poco la diferencia salarial entre las dos partes. Ah, Comentan los beneficios.
oh, sí, perdón.
Los mexicanos les gustan llamarlas prestaciones.
Um, la aseguranza que yo he recibido de los dos lugares donde yo trabajé fueron muy buenas. Me cubrieron las visitas al doctor, medicaciones. Dependiendo de cuánto quieren pagar por su aseguranza, hay muchas diferentes aquí. Um, pero también pagan para, is it like, how do you say 401k? I guess I don't know how to explain.
Es una segunda jubilación,
Okay.
programa de jubilación en adición al seguro social. En,
So,
Ujú, dale.
tienen esos programas y si ustedes quieren poner un porcentaje, ellos pagan lo mismo del porcentaje que ustedes están poniendo para eso.
Te regalan.
De regalo, sí.
Te regalan la misma cantidad.
Regalo.
Te regalan. Si tú pones, dijiste el 6%
Ujú,
de tu salario, te regalan otro 6% para tu pensión. Mm,
ujú.
ujú. Muy bien. There is always when people work by salary, obviously your experience also count to modify your salary. The more years you have, your salary becomes a larger salary. Less experience, you don't earn the same salary. And it's important also maybe for people to know almost, I will say, I do not know of a case where a nurse practitioner will ever work but as a salary person. They only are salary positions.
Yeah,
Okay. Once you get into certain roles, they are only salary positions. Doctors are only salary positions.
yeah.
They don't get so. um, Hay muchas cuando avanzas en ciertas partes, ya no eres más, no trabajas por horas, sino exclusivamente por salarios. Obviamente los salarios los puedes negociar basado en tu experiencia, en tus especialidades, pero después de ciertas cosas, incluyendo no solo las enfermeras practicantes, los doctores, todos son posiciones con salario, no que se paga por hora. Okay, so. Um, so that's really important. I know we're getting close to the top of the hour, but I'm sure there are some. If you have no, if you have one piece of good advice that you would like to give to a person looking forward to doing their life, coming to do their career in the United States, does something comes to mind for you that you would like to give them as your nugget of wisdom for them? Si alguien quiere oír una idea o un comentario que tú les quieras hacer para su futuro como enfermeras con su carrera aquí en los Estados Unidos, ¿qué les ofrecerías? Now, I'm not trying to put you on the spot, so if there is nothing that comes to mind, don't be shy and tell me nothing specifically comes to mind.
Um, I guess just to be a little bit corny, always find a group of people to surround yourself with that are always have your best interest and will support you in any opportunity that you want to take. I will say that having a really good, strong and support system definitely made me getting to where I am a lot easier. So always surround yourself by people who will help that growth.
Would you like to attempt to say that in Spanish?
Came up on the top of my head, already
Yeah.
left.
Mayela les ofrece como comentario una de las cosas más importantes es siempre rodearse de personas buenas, que no solamente puedas participar con ellas, sino que todos en compañía tienen, o no, tienen están pensando en el futuro y en las ayudas para todos. I hope I did a fair translation of your thought. Feel free to correct me.
That was great. Thank you.
Yeah, okay. Mayela, one last item that I think is important for people. You know, the Achilles heel of Latin nurses in particular, whether they come from anywhere in the Spanish world, from Mexico to La Patagonia, or they come from Brazil, where they speak Portuguese, is language. So a lot of people feel that just bring me. I will work just in Spanish and eventually I will pick up the language. You think it's a realistic thought that somebody can come and join your team and work if they only knew Spanish or Portuguese for that matter? La
Right.
pregunta, excuse me, I'm going to translate it. So,
Sorry.
just para un comentario final que quiero que Mayela haga. Con frecuencia muchas personas dicen, ay, ¿por qué no me traen a los Estados Unidos? Yo soy español, yo voy trabajando y voy aprendiendo el idioma. Eh, no, no. Simplemente tráigame, yo quiero ya llegar a los Estados Unidos. Es realista que tú puedas llegar a los Estados Unidos hablando solamente español o portugués.
I guess a lot of that speaks to kind of my parents' experience.
Ujú.
When they first came here, they did not know a lick of English. But they came here, they worked hard, they learned by attempting to talk with other people, as much as weird as it sounds, watching TV shows, learning the language, small things like that. I think it just takes a lot of courage and motivation. You're coming to a whole new country, learning a whole new language, and I think that's amazing in itself. So I do think it's possible. I think a lot of it is just pushing yourself to get to that point.
Yeah. But could you have a meaningful work day exclusively if you are a Spanish speaker, working on the step down unit? Could you actually perform your job if that's all you knew? If you were a great nurse but you only speak Spanish in the United States?
It might be difficult.
Requirements aside that the government will not allow you to do that,
Yeah.
but
Um, it, I will say it would be difficult. Um, it can be very fast paced depending on the floor that you're on, because we do have kind of three different kind of cares. But it would be difficult for sure. Um, Learning how to communicate with pharmacy, the transportation, the doctors, other nurses. Your
Doc,
whole day consists of communication. So yes, it'd be
and
difficult, but
and the patient itself.
yeah, and the patient, sorry. Yes, and the patient themselves.
How about
Um,
I'll give it a
but
shot to translate that into Spanish. Sorry.
no, you're okay. Sí sería difícil, honestamente. Dependiendo del piso donde ustedes trabajan, puede haber mucho desorden durante el día y tienen que comunicarse con el doctor, transportación, otras enfermeras, los pacientes, um, farmacia. Hay muchas cosas que tienen que poder comunicar para hacer el trabajo. Eso es el trabajo, comunicación y ayudar al paciente. So sí sería difícil, pero con motivación todo se puede, todo es posible.
Con ponerse las pilas y aprender el inglés,
Exacto.
todo es posible. Okay, Mayela, it's been wonderful, but let me take 2 minutes because I'm sure some people have sent a bunch of questions here. I've been bombarded for the last few minutes with questions, so I'm going to skim through some of them to see if there is anything here that they have sent that I have not already asked you.
Of course.
Okay, somebody asked um, if you start on a night shift, is it possible to switch to another shift? Si alguien empieza en un turno nocturno, se puede cambiar a un turno nocturno. And do you have to rotate days and nights? ¿Tienes que rotar días y noches?
Um, yes, you can move from night shift to day shift. The only thing is a lot of new grad nurses start on night shift. That's kind of the positions where you're going to learn a lot because it's a lot slower paced. But you can definitely move to day shift. It just depends from unit to unit as to what some units require you to stay on night shift for a certain amount of time, before they can switch you to the day shift.
And,
Um,
and the
and well,
openings.
hmm?
And the openings.
And the yeah, exactly. And the openings, depending on the floor that you're on.
Mhm. Translate.
So, dependiendo, de la experiencia, si empezando como enfermera, como nueva enfermera, van a empezar en la noche. Yo empecé durante el día, pero nada más porque había posiciones abiertas durante ese tiempo, pero nuevas enfermeras siempre empiezan en la noche. Pero se pueden mover al día dependiendo de cuánto tiempo ellos quieren que se queden en la noche para poder cambiarse al día si hay posiciones para eso.
Correct. Muy
Ujú.
bien. So that's important. So someone corrected me that I translated assessment as evaluación, and they prefer to use the word valoración. So yeah, increase your
Hello.
vocabulary. I think both of them are you different countries use it slightly different, but somebody wanted me to know that they use the word valoración instead of evaluación for an assessment.
I've definitely said that wrong to a
Mhm.
Spanish-speaking patient, so
No.
we'll use the right terms next time.
Okay. Focus if you consider, and I think most of the questions that they send here we really cover, so I don't think I need to expand that. Mayela, it's such a pleasure having a person like you coming and talking to people. I think it gives really a hands-on perspective of what it is um, to be a nurse in the United States. Obviously, a lot of people want more details of where you're going to go and study or where you're going to study, but I think those are things that, eventually, if you want, I'll share some of those details in the future with people. But we love to have you, and as you start, moving into your MP world, we would like to hear more about that. So to come and share some of those experiences we had. I don't know if you met her from North Shore because you used to work there. There was a vice president of the nurse practitioner group who helps the nurses for that, and I totally forgot. I don't know if Carrie remembers her name. Actually, we have her video in our YouTube channel, talking on how they encourage a lot of the nurses to pursue an MP career and things like that. Carrie, you remember by any chance her name? No, Carrie does not remember either. But there was a she came, but no, we would love to follow you up, no, on what's coming up. I'll thank you, thank you, thank you. Te agradezco muchísimo que hubieras venido. Les comentaba en inglés que vamos a tratar de seguir un poquito la vida de Mayela, cómo se mueva en su vida, en su carrera para volverse una enfermera practicante. Muchas, muchas, muchas gracias. Thank you very much on behalf of everybody. And hopefully we'll see you guys soon. I I think in 2 weeks, Carrie, I don't know if you're still on the Portuguese channel, because I don't know if I can hear you, but I think in 2 weeks we have. I'm blanking out. You see, this is the part when you start getting old, Mayela, you become senile.
Happens to all of us. It's already happening to me.
Yeah, I'm gonna have to start blaming it on something. So let that be. So I'm blanking out what's coming out in a couple of weeks.
Can
Uh,
you hear me now?
yes, I can hear you
Oh, you
now.
can. Okay.
Thank you, thank you.
So, in 2 weeks, the BSR Idiomas, our language partner, is coming, and the topic is demystifying the TOEIC. Is it the right exam for you?
Mhm.
So Robert will be meeting with us then, and we're always looking forward to his presentation.
En 2 semanas, nuestra academia de inglés va a venir a charlar con ustedes. El tema, el tópico va a hablar porque muchas gentes quieren saber sobre algunos de los exámenes alternos. Él va a hablar, van a comentar, sobre el examen que se llama el TOEIC, que entre otras no lo reciben en muchos de los estados, pero como siempre hay preguntas en los diferentes, eh, va a venir a charlar sobre eso. Okay. Mayela, on behalf of all our team, on my behalf in particular, thank you again. Muchas, muchas, muchas gracias.
Thank you for having me.
No, it was such a pleasure to have you here, and we'll hope to see you soon.
Of course.
Okay.
Thank you
Very
so
good.
much. Thank you so
Yes.
much. It was a great presentation.
Thank you, everyone.
Okay.
Buenas a todos, muchas gracias. Nos vemos en un par de semanas.
Good night, everybody.
Good night.